my name is Romina Murillo and I'm going to talk about patellar fracture with a slip avulsion. The patella plays an important role as a part of the extensor mechanism of the knee in addition to protecting this joint from direct trauma. Fracture of the patella is a traumatic disease frequently observed in the emergency department. Their behavior is very varied depending on the intensity of the trauma.
Patellar fractures. Basic anatomy. You can see the femur, the tibia, the fibula, and the patella, which we call it the kneecap. The kneecap is attached to the quadriceps tendon at the top and to the patellar tendon at the bottom. Movement of the patella across the knee is normally a gliding, smooth movement. A patellar fracture is an injury to the kneecap. These fractures are commonly caused by a direct blow to the kneecap or from a fall. Patellar fracture types. Transverse fracture. The fracture can be non-displaced or displaced. This is an example of a non-displaced fracture. Displaced fracture. The patella can be pulled apart by the attached thigh muscles. The patient will be unable to do active extension of the knee. Upper or lower pole fracture. The fracture at the site of the attachment of the patellar tendon, as you can see here. Comminuted fracture means multiple pieces. The fracture can be non-displaced or displaced. This fracture type shatters into 3 or more pieces and is very unstable and hard to treat. Vertical fracture. The fracture is non-displaced and stable. The fracture fragment usually stay in place during healing. Osteochondral fracture. A small fracture of the patella usually associated with acute dislocation of the patella. The osteochondral fractures are usually located in the facet area of the patella. Treatment. Example of a transverse patellar fracture. If the fracture is non-displaced or minimally displaced, and the patient is able to do full active extension of the knee, the patient is usually treated by a knee immobilizer or a brace. Transverse displaced fracture. The patient is unable to do active knee extension. Usually, this displaced fracture is treated by surgery. You can see here reduction of the fracture with a reduction clamp. K wires are placed perpendicular to the fracture. Figure 8 tension band wire is applied for compression of the fracture. These tension band wires convert the anterior distractive forces to compressive forces at the articular surface. As the knee moves in flexion, there will be compression at the articular surface. The other technique is cannulated lag screw with tension band. The wire passes through screws and crosses the patella in a figure 8 tension band. Partial patellectomy. It usually involves the distal pole. A smaller fragment are usually excised. The patellar tendon is reattached anteriorly with sutures. Total patellectomy. It's usually indicated for comminuted and displaced fractures of the patella that cannot be reconstructed. The bony fragments are excised before the reattachment of the patellar tendon. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.
As a diagnosis, it is necessary to specify the antecedents of direct or indirect trauma. The patient comes referring a new pain and inability to extend the leg after landing on the flexed knee. Physical examination reveals superior displacement of the patella, and a radiograph shows a fracture of the patella of the inferior pole. The diagnosis is confirmed on the day of injury during open reduction and internal fixation.
All right, so I'm going to take a look at your knees. I saw you walk in and we took a look at them there. So now I'm just going to look at them from you laying down. They look pretty good. I'm just going to look a little bit closer to here to see if you have any swelling. And I don't see any. Okay, good. We're going to bend your leg here. Does this bother you at all?
No.
Okay, good. How about this here?
It's okay.
Good. And then just rest your heel on the table there. I'm going to push in some different spots. You let me know if I hit anything that's sore. Any of that bother you?
No.
Okay. I'm going to push over here. Good. Up here?
Yeah. It's okay.
Okay, one last spot. Kind of right in here. Anything there?
No.
Okay, good. All right. We're going to move your leg around. Just relax it. Does that bother you?
No.
Good. Good. And then just relax your leg. Relax. Good. Very good. Okay. I'm going to let your leg just kind of hang off the table here.
Okay.
Does that bother you?
No.
How about that? Okay. All right. We're going to twist it around, and again, let me know if any of this is bothersome. Anything there? Okay, we're going to do it one more time. Good. Okay, very good. If I push under here, does this bother you at all?
No.
How about this side?
No.
Okay. Flex this muscle up for me and relax it. Good. And flex it up again. Very good. Okay. One last spot here. As I bend your knee there where I'm pushing with my thumb, does that hurt?
No.
Okay, good.
As a treatment, we could say that the first action on the patient is aspiration of the intra-articular blood, application of ice and analgesics, and later immobilize the limb. Treatment principles are similar to management of these fractures in adults. Fractures that are displaced require open management to restore function of the extensor's mechanism.
In this video, we'll demonstrate the repair of the broken patella in the knee using a surgical set designed to fix it. The patella is a small floating bone that glides over the femur or thigh bone. It connects the muscles of the thigh to the tibia or the shin bone, helping the knee to move. The cartilage or the eggshell type covering on the underside of the patella and front of the femur allows for smooth motion of the knee. The patella can break due to trauma. First, the surgeon uses a clamp to close the space between the two broken halves of the patella. Then wires are placed to hold the broken bone together. The surgeon then drills through the bones where the wires are placed. And the drilled holes are measured to determine screw length. Then the correct screws are placed into the drilled holes. And sutures are placed through the screws to make a figure 8 pattern over the patella, holding the bone structure together. This completes the repair of the patella.
As a complication, we can say that the most frequently complications are the infections that rates as high as 2 and 10% have been reported. Found healing also may be problematic, especially with associated soft tissue lesions. Also exists this complication, as loss of fixation or reduction, hardware permanent, stiffness often occurs after prolonged immobilization. As a conclusion, we can say that the patellar fractures in children are rare, but when present affects patients younger than 15 years old. This happens because patella is more flexible during childhood and is less subjected to impact and tension force during quadriceps contraction, being also involved by a large cartilage layer. Those fractures can be caused by direct trauma, excessive contraction of the extensor mechanism, or by both. The major difficulty regarding patellar fractures in children is the diagnosis. Congenital abnormalities may be confused with fractures, and the size of the fragments, particularly in slave-type fractures, may be underestimated in children due to the cartilaginous nature of the patella. Thank you.